Welcome to the Untold Stories of Noviski Hall. I'm Raul, and I'm the host on today's episode. And Noviski Hall sees all kinds of patients, and that today our dental hygienist, Susan, had an unfortunate event.
Come on back. Hi, I'm Michaela, and I'm going to be your dental hygienist today. How are you?
Well, I've been pretty stressed, and I've been stressed about school life and at home. I didn't eat breakfast today, so I'm feeling a little bit weak, but I'm doing okay.
I'm so sorry to hear that. Are you okay to continue treatment today, or did you want to stop?
No, I'll be okay. I've had a fear of the dentist office since I was a child.
Okay.
But I'll be okay to continue.
I'm going to do my best to take care of you. Okay, I know you said you have a fear of the dentist. Can you elaborate on that for a little?
I've always had bad experiences at the dentist. They just scare me. It scares me to be in this office. I'm scared of needles. I'm scared of everything with the dentist.
Those needles that you asked me for, Susan?
Oh my gosh, I can't believe I told you Michaela. My name's Susan. I got a name change last week.
I hear how being stressed and skipping meals aren't good at all, especially for being somewhere that scares you. It can lead to so many problems, such as fainting, increased blood pressure, having less energy, and many other problems that could lead to bigger emergencies such as seizures and heart attacks. So I should have eaten and tried to relax before I went to my late dental cleaning, but I learned my lesson real quickly that day.
Erica, I noticed you're sweating a little bit. Do you need me to get you a cup of water?
Well, I'm just not feeling well. I feel hot and I also feel cold, but I have the goosebumps. I'm a little bit nauseous, but I'm really thirsty. Yes, please.
Okay, I'll be right back. I always take care of my patients. When I noticed my patient was showing signs of presyncope, I first stopped my treatment and removed all instruments and materials from her mouth. It was quite alarming that my patient was a young, healthy woman, yet she was showing signs of presyncope. My patient mentioned that she was stressed and she had skipped a meal earlier that morning. She had an overall fear of a dental office. I'm thinking, great, what else is going to go wrong? Just as I thought I was solving the situation, I was about to find out it was going to get a lot worse.
Michaela, Susan tried to de-stress Erica, but can see herself getting worse by the second.
I was finishing Erica's history report and she started to sweat profusely. I went to get water for her. When I came back, she was pale and shaking. I knew something was wrong. Her blood pressure was elevated to 140/100. Quickly, she began to shake and fainted in the chair. Erica, I noticed you're getting pale, so I'm going to lean you back and check your vitals to make sure you're okay. I'm also going to elevate your feet. Okay, your blood pressure is 150/100 and your pulse is 80.
Oh, I'm not feeling good. I'm seeing spots and it's like a black tunnel.
Anai,
Yes?
can you call 911 for me, please? My
Yes,
patient
I'll
just
call
passed out.
911.
Ring, ring.
911, what's your emergency?
Hello, I am calling from the Untold Dental Clinic. One of our patients just fainted. She lost consciousness, her blood pressure is really low. Her address is Noviski Hall 900 Yale, Northeast on the UNM North Campus.
Okay, what number are you calling from?
505-435-0933.
And what symptoms was she having?
She began to hyperventilate. She mentioned earlier that she skipped a meal and that she was stressed out.
Okay, rescues are being sent to your location. Meet them outside and make sure to stay on the phone with me.
Okay, thank you. Syncope is sudden transient loss of consciousness and postural tone with spontaneous recovery. There are 3 types of syncope: cardiac syncope, non-cardiac syncope, and neurocardiac syncope. Syncope is the most common medical emergency in the dental office. Cardiac syncope results from inadequate cardiac output. usually from underlying heart disease. Neurocardiac syncope is activation of the autonomic nervous system, fight or flight response. And non-cardiac syncope can be caused by orthostatic hypotension and situational occurrences such as coughing, urination, defecation. In a medical emergency, it is important to understand the repair steps are recognize the signs and symptoms of the emergency and stop all treatment. Evaluate the patient's level of consciousness. P, place the patient in the appropriate position. A, activate the CABs of CPR by checking the circulation, airway, and breathing. I, implement the appropriate emergency protocol for the specific emergency. And R, refer the patient to the appropriate healthcare professional. I have the oxygen tank.
Thank you.
Let me put in her vitals.
Okay, so I got her blood pressure at 100/60, her pulse at 50 beats per minute, and her respiration is 16.
Okay, got it.
All right, let's give her oxygen.
Yes. Come right in here. Here's the EMS.
Hello, Armando. What happened?
Okay, so I was finishing Erica's history report and she started to sweat profusely. I went to get water for her. When I came back, she was pale and shaking. I knew something was wrong. Her blood pressure was elevated at 150/100. She quickly began to shake and fainted in the chair.
What was her pulse and blood pressure before she fainted?
Blood pressure was really low. After she fainted, it was 100/60, and her pulse was only at 50.
And is she taking any medications or what?
No, the patient doesn't take any medications. She has no diseases or conditions. However, she stated she was under stress and anxiety about the dentist, and she also skipped a meal this morning.
Okay, I'll take it from here, guys.
Thank you, Armando.
Yeah.
Okay, Erica. So in order to go home, you're going to need an escort.
And you do need to make sure you eat and drink a lot of water, and if you're not feeling good, go to the ER.
Thank you, Armando. Thank you, Susan.
Of course.
Oh, and then call me. Positioning Erica in the supine position with her legs elevated will bring blood to important organs such as like the heart and brain. And then it's important that we bring her up slowly when she feels better, so it helps her not feel so dizzy. And I will have to say that they are very well trained hygienists, and we could have had a worse situation.
So on your emergency contact, it has your sister Anaí, which I'm going to call for you to pick you up.
Do I have to? I could drive myself home.
Well, unfortunately, it is our protocol. It is to keep you safe.
Call that girl.
Anaí, your sister's in here.
What happened with her?
She fainted while she was in the chair.
Erica, are you okay?
I'll be okay.
Oh my gosh, what happened?
She fainted when she was in the chair. She was telling me earlier that she didn't eat and was really stressed out.
Oh my gosh, let's go home.
You say so, sister.
Thank you.
You're welcome. Bye. Bye. I hope you feel better.
Thanks, Susan.
It's not always an easy day for Noviski Hall. Anaí and Susan always had easy days, but today wasn't so easy.